We've discussed that we can identify these viruses, and as we understand now that long COVID can be a chronic illness in the same way as we see autism, as Lyme disease, we see this pandas syndrome, and
Yes.
picture actually of all these symptoms is very similar. The more we do research in identifying causes, the more we see that there is a very common thing among all these illnesses. And I would like to summarize this, that talking about the GI issues in particular, we need to look for infections, we need to look for bacteria, we need to look whether it is yeast or mold, and these tests are present, and we only need to identify the right infection and find the treatment for this particular infection. So as you have mentioned, Oleg, you've seen recent research talking about the Lyme disease and the link to long COVID. Could you share a little bit of scientific research, what you have seen on this Lyme
Mhm.
disease?
Brief explanation that some symptoms of long COVID infection, like fatigue, like brain fog, rashes, could occur in approximately 30% of patients, could be because of Epstein-Barr virus infection and just reactivation. They use some randomly selected patients, about 200, and found that they have the symptoms after the initial recovery from the COVID. From this people, they find early antigen diffuse immunoglobulin G or viral capsid antigen immunoglobulin M titers, so they high titers to this infection.
Could you then give us an idea how, from your protocols that you give to
Mhm.
patients with these particular issues after you have identified whether it is bacteria related or specific virus, is there a solution which is definitely working between all these viruses, or it is very specific to the virus and you have to go very specific according to tests
Uh,
you do?
it's a difficult task. Why? Because I work with the patient with autism and chronic infection about 5 years. The first time it was very difficult because you must understand that it's not the only infection. When some ill patient come to you, you will see usually only one kind of infection. It could be bacterial, or it could be a yeast, some kind of infection. And when you just to treat this, and patient become healthy. And this situation is totally different. When people have chronic infection, the problem with, for example, for long COVID is because this virus of SARS-CoV, it like reactivate all this infection which is in body. So when they have Borrelia, so it could activate. So when they have some Klebsiella, it could activate. I treat some kind of mitochondrial problems because we always have intoxication. Patient always have intoxications. The mitochondria is very weak in this situation, and we have fatigue problem with sleep and so on, insomnia and so on and so on. We always have to see for adrenals, for thyroids. We need to use all this kind of treatment in one protocol, and then we will see the results. So it's not only fighting off infection, it's some kind of helping our body to do something with this infection as well, just to make our immune systems much stronger. And also we use some kind of vitamins, maybe later probiotics for gastrointestinal tracts. I use mainly supplements. The problem is we don't have much research and study about which kind of plants some supplements help exactly this kind of infection. And that is the real problem.
Could you
And
summarize which ones are
no,
the common ones?
for example, for gastrointestinal tract, we use plants with berberine It could be golden seal. Garlic, it's allicin. For example, the company Alimax has the finest supplement with a high percentage of allicin. Allicin could fight bacteria, virus, and yeast, and even parasites. So it just a very broad infection. So I use very much. Also for yeast, it could be undecin acid, caprylic acid, uva ursi, mainly this one. Sometimes when I see that I couldn't stop this infection, I can use, for example, for bacteria, I use bacteriophage. It's difficult to find in Europe and maybe in United States, but it's easy to find here because in Russian and here in Ukraine, we use it much more. And together with herbal supplements, we have good results with this. Also, we can use, for example, cat's claw. We can use powder arco, oregano sometimes, and even grapefruit seed extract as well. For example, for yeast, it's also work good. Sometimes we have patients that have a very specific reaction to oregano. It can worsen the situation, not help patients. So for me, testing is very important before treatment. And then I see I have a properly testing, I can find the properly infection, and I find a properly supplement. And then when I don't have results, it's a question for me, what I'm missing. Because when we just tell people that you can use all this and this one, they can use it and then tell we don't have really good results. And I say, okay, because without testing, it could be. We can use all the supplements, but for every patient, I testing as well all the supplements, and then we will see the results.
So from your expertise, children with autism, do they develop these GI issues? Do they, as the initial phases, do they have these symptoms?
Look, when I first trying to consult all these children, I saw the article of American scientists that stated about 80% of children has a gastrointestinal issues. In my practice, all 100% have. All
so is that
100%.
important of having a gut health in good condition and microbiome in good condition?
It's very important.
So
it's
what are the main
first
components to build this strong microbiome when it is damaged?
In my protocols, the first what I recommend is the diet. We have 10 or 13 different diets that can help child.
It's very important. I think all our listeners will be now writing down what diets are working and what diets improve.
Yes, we have some problem very often with gluten, with casein, with lactose. We have some problem with oxalate, with phenol, with glutamate, sometimes with such kind of products like corn. And I see every patient that has mold infection has a problem with corn. We also need to understand exactly what diet could help this special child. And also testing for all these products, for these metabolites, and we then understand this child has some oxalate problem, that the high oxalate the products we must just step. Yes.
And what products this usually are?
Oxalate, almonds, for example, because sometimes they use not real milk because they have some issue with casein or lactose, and they use almond milk. Yes. And almond milk has a very it is very oxalate. So why is it not suit? So we need this to change for coconut milk or for rice milk and so on and so on. For example, Klebsiella very like the starch. And if we see that a patient has Klebsiella, we need low starch diet. And also FODMAP diet is very helpful for such patient. It's the first what I recommend. So we need to see what kind of diet is very helpful for this special child. And then we recommend this kind of diet. And then is the enzymes. Usually I use for children with autism Enzymedica. Is very popular enzymes. We can buy it in iHerb, or we can use some kind of Trienza. It's a Houston enzyme company. So Trienza is very popular as well. Why we need this? The working of pancreas is very compromised in every chronic condition. Why? Because the pancreas has a different action. It produces metabolic enzymes which absorb all this our products in gastrointestinal tract and help just to use it properly. Also, pancreas produce glucagon, and insulin is like hormones for carbohydrates metabolism. And pancreas produce trypsin and hematrypsin. It's some kind of metabolites that help in chronic infection with all this inflammation chronic. And sometimes we can feel when we have acute infection, we don't want to eat. It's because pancreas in this state just to switch to proper working against inflammation. And the same I see in chronic infection. But in chronic inflammation with children, we don't have such acute situation. But process is the same. And the problem is when we use the analyze, we don't see such numbers that we see in acute infection. And why doctors say, oh, it's okay, you didn't see anything in your analyze. I don't see anything in your analyze, you are healthy. But people with chronic infection, because all these numbers are much more lower. But the chronic infection is organism in bodies of this patient. So the pancreas is very important, and enzymes help to work this pancreas in chronic inflammation. Then we use some kind of adsorbent. So it could be active charcoal, or it could be enterous gel, or it could be a different kind of adsorbent. Why? Because they have important two functions. The first is they absorb this kind of meal we didn't use, and also this meal help organism just to grow, and as well as a bad organism as well. And the second one, when we try to use antiseptic or some kind of supplement that can fight all this infection produce, when they are dying, they produce all these toxins. Mm-hmm. And this adsorbent absorb all these toxins and also take it out from our body. And it's very important. Otherwise, we have a Herxheimer reaction. And for people which struggle a long time, it's very important because these people don't have much power. And when we trying to find advance all kind of infection, we have a very bad state, a very bad reaction. So we have to do it step by step, just a little, step by step, step by step. When I try to treat a mold infection, before I use a very high dose of adsorbent. And I see that is a very strong Herxheimer reaction. And when I try to make it lower dose, so it's much better for children. And I think for the chronic inflammation with adults will be the same. Then adsorbent. Another one is a kind of probiotic like Saccharomyces boulardii. Saccharomyces boulardii is the only probiotic, a probiotic which I use because it makes a space for the good bacteria. It invade our gastrointestinal tract. Then we can give the good probiotic like lactobacillus or just even better like a spore probiotic, for example, Bacillus subtilis. And this kind of treatment then work much more properly and give us good results. Also, we can help with oxidative reaction, with oxidative stress. So we antioxidants give all these people, for example, like resveratrol, sometimes maybe catechin, green tea catechin, and so on and so on. So different kind of antioxidant help to fight against free radicals and all this oxidative stress. So it's for beginning, it's enough. And then we just to look for some mitochondrial issues, for some neuroinflammation, and so on and so on. And we help people with some different supplements, like for neuroinflammation, Bacopa, ginkgo biloba, and so on and so on. So we have a different kind of plants that is working exactly in some places. And for example, ginkgo biloba very helpful when we have thrombosis.
As usually, we're gonna have at the end a couple of questions to you from our patients. And one of them is how to deal with diarrhea, which is severe and for very long time.
In this situation, we need first one, we need supply with some minerals like rare polyglucine. When we have a long time diarrhea, maybe it's better just to begin with some infusion maybe, and then just go on with some supplements. We need microelements. So we need absorbent, because diarrhea, it is a process which is a result of the organism that is looking just to take out some toxins. So some infection produce some toxins, and our organism trying just to go all this out, and we have a diarrhea. We need to find exactly what kind of infection and some treatment for this infection have. So we need absorbent that takes these toxins out. So we need just more fluid, because patient lose fluid. Also with microelements, because we lose also microelements. It is important, sodium, natrium, kalium, sodium, and so on, so on. So also we can give like Saccharomyces boulardii, because Saccharomyces boulardii are trying to find all this infection, just take this out of gastrointestinal tract. So this is the most important steps we need to.
Thank you. And the last one, I would like to give you a case with GI issues and underlying symptoms as well. So if I just read it through, so we have a girl who is 9-year-old. She has nausea every day, sometimes a lot, sometimes a little. She has got pain around the belly button, and since October. So all this time she's with the pain, and the pain, the localization of the pain is inside in a small area, like a small circle around her belly button, and it stays. It doesn't go away. Together with that, she has got a brain fog. She's mixing up words, more forgetful, confused, very poor appetite. The reading makes her nausea again, and she can faint even sometimes in the shower. So this is quite widespread forgetfulness and weakness and heart rate, which is showing sort of POTS syndrome, which is suddenly happens and disappears, and this fatigue with lots of sleep. So all this together is it's quite difficult, of course, to say what is
Yeah,
the
true.
only problem to that. But looking into from perspective of GI issues and this particular localized pain, what
Mhm.
would you advise what it is, at least theoretically thinking what it possibly can be?
Sometimes it's difficult to say exactly. If it's a long time, so it's
Yes,
not
it
like
is a long
acute
time
infection. It's a
and it is
long time.
constant. So the girl
So
doesn't allow to touch this place because it's so painful to her that it's so sensitive around the belly button that she even, doesn't allow to touch it.
if we look just for wall case, I wouldn't say it's one kind of infection. If we don't take this pain, especially in this place, so it could be like Borrelia or Bartonella, because it could influence our brain, our heart, our joints, and our gastrointestinal tracts. And the one bacteria or some one microorganism can invite different system of our body. I would start with that kind of thinking. And then I would say probably, yeah, because the strong pain in region of umbilical region, I would say it's a problem, could be problem in the small intestine, because it's some kind of region where the small intestine is some part of gastrointestinal tract. And the small intestine, we have infection with inflammation, with organic. We don't know exactly what I used. So the first part is try to find exactly infection. So, for example, we can take the stool for analyze. For example, comprehensive stool analyze. What we will see there, or microbiome for some kind of infection. Then some investigation about this different kind of infection like Bartonella or Borrelia. So we are looking for antibody in immunoglobulin G in the blood. Why I think about multifactoring? Because we have tick. It's difficult to find connection with tick and gastrointestinal issue, especially in this region. So why I think it's a more reasons for all the state in this patient, in this girl. And tick also could be strong, difficult infection like Borrelia Bartonella. You see, I think the first line is this infection, and then microbiome or a comprehensive stool analyze to find what kind of infection we have in gastrointestinal tract. The starting protocol I told before. So the first place, diet. So the diet must be like FODMAP diet, because in this region usually could be the small intestinal bacterial overgrowth like SIBO, or SIFO like small intestinal fungal overgrowth. And we usually we will see if the food map diet helps. So we probably differentiate because between these two kind of infection. If not, we were looking for parasite. What kind of parasite can produce the symptoms? Because it also could be, sometimes we even find the parasite that we even don't know that it could be in this child. So the parasite also could produce such symptoms.
And when talking about, as you said, food map diet, so what do
Yeah.
you mean? What it is?
It includes 5 or 6 mainly carbohydrate, fructosaccharides, oligosaccharides, disaccharides, syrups like maltosa, xylosa, or so. So it's a different kind of carbohydrates which can produce dysbiosis, which can like be some meal for bacteria or fungal
So
infection.
people should exclude all of them.
Yes,
as a trial.
yes. For example, for the beginning as a trial, and we will see if it helps. Then we will understand that it could be some bacterial or a fungal infection.
And if people will exclude these products, after how long they should see the result? Are we talking about a couple of months or weeks?
No, 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 no. You will see the people see the results for 1-2 weeks at once. So we will see at once, because if we have a really strong process in our body, inflammation, some kind of inflammation, and even when we trying just to change the diet, we always see some results.
I see. And if it comes to a thing that they will identify this Bartonella infection, what is the treatment then?
Again, it's a difficult task. Why? Because usually, for example, for Borrelia, a chronic Borrelia infection, and antibiotic therapy only helpful about 20%. In acute infection, opposite, about 80% helpful. But in chronic, it is a study, and it was stated in the study that it's only 20%. So we have a different solution to help these people and treat this infection. In my practice, I also see chronic Lyme, and we use herb protocol with herbs. For example, today the most famous is Buchner protocols, and also Buchner, Coden, also some Dr. Raymond has some kind of protocol. So why herbal protocol important? Because it's a chronic infection. We can use an antibiotic or different kind of medicine because it has a lot of a bad influence on our body. We can use it only for acute infection for the short period of time. And herbal protocol, we can use a much longer time.
Thank you for your time and for joining us in this long series of symptom discussions, helping children and families to recover from chronic diseases. So thank you for your time and see you next time.
Okay, see you. Bye bye.
Bye.